Hello, everyone. Welcome to Minds on Mushrooms, where we unveil the magic behind psychedelics for mental health and addiction. I'm your host, Maggie Kirkwood. I am excited because I now have a podcast and a little bit about why I'm here talking to you. My life was greatly impacted for the better with plant medicine. And I wanted to, create a space, a safe space where we can share stories, listen and learn from professionals, and just kind of keep on top of what's happening in the mental health game because it's pretty exciting. So today, I'm so excited. My guest, Angie Hanson, is here. Angie is 41 years old. She's a design professional. She's a mom. And she's here today to talk about ketamine assisted therapy. She'll tell you all about it, but essentially it's classed as a anesthetic, right? But it's been proving to have super positive effects with people who suffer with major depressive disorder and who have also been who have treatment resistant depression. So,
yes. Well said.
Thank you.
Yeah, and ketamine is considered a psychedelic treatment for depression.
Thank you.
So I guess part of the reason it caught my eye is because I don't think plants should be illegal. So anything that is working towards that process of legalization and gathering that kind of data, I'm in support of. It's a good cause. So thanks for having me and thanks for supporting a good cause.
Well, thank you for saying that, Angie. Yeah, so let's hear. I know you have quite a story to tell. And, first of all, I just thank you so much for being here and sharing your story and your vulnerability, because obviously talking about mental health, it's not fun and it's yucky and scary. And I really appreciate you being here and sharing your story with us. Thank you.
Yeah. And if there's anyone out there listening that can benefit, or if you have a loved one that you're really worried about, this is really the reason why people like me come out and share these stories, because it can be deadly. It's a dangerous disorder. So, and it's very serious. And if you're treatment resistant yourself or someone you love is really struggling, I have found great relief with this. So there is hope. But basically, I am coming from about 10 years of struggling with major depressive disorder. It started off when I was pregnant. So I was diagnosed with, it's called perinatal depression. I think a lot of people have heard of postnatal.
Yes.
But perinatal is during
Wow. Okay.
And after. So,
wonderful.
Yeah, extra fun pregnancy.
Wow. Yeah.
Yeah. So I was able to get on some medications that were working really well for a long time. But then I found out recently, only just this past winter, that I was high risk for stroke. And I probably shouldn't have ever been on that particular medication.
Yes.
So that was really scary.
Wow.
I mean, if you're thinking about, trigger warning, suicidal ideation or things like that, that's something that you definitely want to prevent and stay medicated and healthy and happy. But I also don't want a stroke,
Exactly. Yeah. And we were talking, hadn't you known someone in her young 30s who suffered from a stroke, and it was like super real to you?
It was literally just a Christmas party with some close gal pals, and she opened up about the fact she was still recovering from a stroke, and she was a young mom of a teenager. I just was really blown away that someone so young had a stroke, and hearing about her journey was really humbling too. So
here you are, you're finding out that the medication that's working and helping you with your depression, you can continue taking it, but you're at high risk for a stroke.
Right.
Okay.
So at that point, it was clear to me that I just needed to stop taking it and work with my psychiatrist to find a new solution. So the journey started. It was winter. It's Minnesota. it's cold, it's dark.
Tis is.
So it's not good timing. I mean, it's never good timing, but I feel like there's also like that seasonal affective
For
disorder
sure.
that
Yeah.
is influencing all of this too. So, um, I did do partial hospitalization. I did do outpatient.
Wow.
I had to take 4-month medical leave. So things got pretty heavy pretty fast.
Wow.
I kind of expected it, but once you're really in it, it's like you can't see the forest for the trees.
Yes.
You know,
Forest from
it's
the
it's
trees. Yes.
really intense. It's right in your face. It's kind of like living in like a staticky TV nightmare.
And I think just from talking with you, you had said at times it felt like your kid or your baby or your son might be better off without you with it.
Definitely.
It's just like so devastating to hear that, and just having that you were that dark, that low.
Yeah. And, people don't, I think people have this view of depression like, oh, they must be just kind of down in the dumps and kind of have like this down low personality. But I mean, I like to reference like Anthony Bourdain, like he was a TV personality. He had a lot of wonderful things to say and do with his life. It's really not your personality.
Right.
It's something that's really affecting your whole body, particularly your brain. But I really felt it in my whole body too. Just this really intense heaviness, difficulty moving through the day, or really getting out of bed. And I'm sure a lot of listeners are familiar with that feeling. But it's when you can't get relief and nothing is working. That's when it starts to get to be that treatment resistant where we're wanting to introduce psychedelic therapy to kind of intervene. So
Gotcha. Yeah.
we're fairly progressive in Minnesota because ketamine is a legal option. But it's not like Oregon or California where there's other options right now.
Nothing was helping. How was it that ketamine assisted psychotherapy came? Did a doctor recommend it to you, or how did you find out about it?
Well, after partial hospitalization and then outpatient, they're helping you to create a plan so that you don't relapse. So part of the relapse plan is to find a therapist that can continue on. And I got a nice long list from the clinic I was working with. And one of them was ketamine assisted psychotherapy. And
Okay.
it just, like I said, it caught my eye because I know that I personally believe that mushrooms are a plant that shouldn't be illegal. And ketamine is kind of that stepping stone to like get to legalization for psychedelic therapy with other mediums or modalities. I don't know what's the right word.
That's okay. But so essentially you ketamine assisted psychotherapy was an option for you, and you personally were interested because it's a plant medicine and based along what we're here talking about today, plant
Yeah,
medicine
it's
for
kind of
mental health.
like a stepping stone
Sure.
towards that psychedelic therapy with psilocybin.
Okay. Thank you.
And I do believe it should be legal. So I was like, whatever I can do to contribute to that data set of how it is beneficial,
Right.
I'm happy to play by the rules. I'm happy to be, the guinea pig because I think ultimately it's for a good cause. And I think people that are working in that world are passionate about that too. So supporting them in their career and their research felt important to me. So I might be suffering, but I still want to help make the world a better place too for my son and others.
Love it. Okay, so let's talk about your experience. Yeah, what does it look like? How do you sign up?
Yeah. So I went the clinic route where you get 6 therapy sessions leading up and you get to know your therapist better.
Okay.
There's also infusion clinics. You can just go straight for the medicine.
Oh,
But
straight
for
to get shot
me,
up.
right.
Yeah.
It's just like, but I thought it would be important just considering the place I was in my life to really have some hand holding,
Sure.
the baby steps, and yeah, build that trust. I think I didn't feel like I'd get as much out of it if I just went straight to the injection.
Well, I
So it is
think,
injected.
yeah, I think what I find so exciting about this and my personal experience is it is really about the therapy, like if you're, if you're an alcoholic and you quit drinking, great, grand, wonderful. But if you haven't dealt with all of your shite, what do they call that? A dry drunk? I'm not sure. But the
Mhm.
same, and I think that why another reason, we're here talking about this plant medicine is everybody knows how it's used recreationally and you can trip out and K-holes and whatnot.
Right.
But then, what we're all learning or what I'm so excited about is the fact that therapy with the use of
Mhm.
plant medicine used intentionally is really leading to some marvelous outcomes and helping people, become not depressed and suicidal and
Yeah.
helping with addiction. So you had some intake so intake sessions. So you got to know your therapist, you got to know your nurse. And then when it was time to like describe that, do
The
you go
actual
into it?
session.
Yeah. And is
Yeah.
it like yeah, what does it look like? And
Well, I felt like it was almost like a spa experience.
wow.
So you go in, it's not scary at all. It's not like it's not as clinical as you might think. It's very much like a nice, beautiful reception area. And then they take you to the room, which is very comfortable. There is headphones and music and a comfortable chair, and they'll give you like blackout eyewear so that you're not having like that kind of visual drag that might happen without them. So you can really focus on your kind of internal intentions. And I think it's all about checking in with your therapist, reminding yourself of those intentions for healing. And she's there the whole time. It's kind of, like I said, the hand holding is really
Yes.
nice.
So let's talk about music. I mean, did you create your own playlist or did they have, how, tell me about that.
Yeah, I had mentioned to her that I really liked binaural beats. That's where it'll have headphones and like a slightly different hertz frequency on each side, and then your brain will synchronize with that. There's also solfeggio frequencies. So the idea is that different frequencies can help with different things such as sleep or relaxation, clarity,
Wow.
focus. So
Maybe I should be listening more.
yeah.
So you knew that this would be along the lines to helping or increasing maybe the benefits of your
Yeah,
session.
and just kind of align with my personal interests,
Yeah.
just being a yogi of 22 years and, yeah, I guess I'm just open-minded to the world of healing in general,
Yes.
so that's probably another big reason why I
There
was
you
drawn
go,
to
girl.
this. Yeah.
Yeah. Okay, so then what happens when people are saying, do you get shot up or so is it an IV or
I heard that infusion clinics are an IV. In the case of this clinic, it was an injection. And so when you do your intake with your nurse, they'll look at, are you on any other medications? Weight and height, physiology. And then she'll prescribe a dose and discuss it with you. She can kind of even give you context of what people take for the first time generally versus what they might take on the sixth time. And so it's a pretty robust discussion. And they compare it to a roller coaster.
okay.
So they'll give you just the half dose to start. So you'll kind of get moving along the track, right?
Hmm.
And then if you don't like that feeling, let's say you're just really queasy, you want to throw up, something like kind of a bad personal physical reaction, then you don't have to keep going down the hill of the roller coaster. You don't have to do the loop de loop. You can just kind of taper off.
Okay.
So I thought
Well,
that was
how
like
are
a
you
really,
feeling?
yeah. So I was so happy to have a break from just the heavy, terrible, oppressive feeling in my body, so I could see where someone that's having chronic pain would have so much relief,
So
or
so right away
that
from the
feeling of
injection,
kind
you
of
just felt like
the
this
half dose even.
major wow.
Yeah.
So then
So for me,
that
it was a good thing. I didn't feel queasy.
and were you like, give me the other half?
Yeah. So when she checked in again, she's like, how are you feeling? Are you ready for the other half? And I was like, definitely. I feel like I'm dissolving into the universe. And it was such like peace and clarity and honestly like a intense feeling of love,
Okay.
which
Wow.
was a feeling I hadn't been able to feel or
Oh,
experience for months. It's like when you're in this really dark place, I think that's what is kind of the worst part about it, is that feeling of complete disconnection from others and the
hmm.
world, and like wondering what's the point.
Right.
So when you finally get just that relief, it's almost like a blank slate of like emotion. And to me, that really relates back to like your brain becoming more neuroplastic and maybe forming some new pathways that aren't this terrible rut of depression.
So a medicine that helps our brains grow
Yeah.
rather than murders our brain
Yeah. It's not
cells.
like the Dare commercials, like, this is your brain on drugs.
Right.
Yeah. Just crack.
Well, that's so wonderful. So you're feeling within the session amazing and all of these emotions and feelings that you hadn't been feeling. And then yeah, so that it happened right away, but then did you see that what do they say, like a halo effect from your treatment, or how, tell us for like the next day and through the next couple weeks what that kind of looked like for you.
Yeah, they don't want you to drive. I personally am not a super chatty person all the time. I'm chatty right now, but we've
Thank
been
God.
preparing for this. So I tend to be really quiet. But I didn't necessarily think I would want to talk about afterwards. So I called an Uber personally.
Oh,
Other
okay,
people
yeah.
might want to call their partner or their, best friend and have them pick them up. But for me, I'm just kind of an independent person.
Nice.
So
Love
I
it.
wanted to like be able to like process and internalize. And I didn't feel like that disoriented or anything. Sometimes people will have like that visual drag kind of continue for a while.
Okay.
But yeah, I was just kind of seated and talking with the nurse and my therapist and kind of decompressing. And they were taking notes,
Oh, good.
in case you don't totally remember everything you were saying. They can kind of refresh your memory at the next session. So that kind of integration piece you mentioned.
Yes.
So you get home and they kind of let you know that you're going to be a little tired. I took the most epic nap. So that
Oh,
felt
wow.
really good.
Yes.
And I couldn't help but think while I was laying there, like how amazing would it be for someone just to come to your house
Oh,
and
yeah.
let you do the experience in your home. So that feels like
That would
maybe the
feel,
next level
yeah.
for a cap session. So
Okay, great. And I want to talk about, accessibility to this. So, you know, was it covered by insurance, and what is the cost around it? Like, tell
yeah.
us more, please.
Well, I feel privileged to have the access. I feel like we should definitely all have access to healthcare and especially mental health care. So I do have insurance. The 6 sessions leading up to the actual injection were covered, just like a typical therapy kind of appointment. So it's classified the same, whether it's working towards a cap session or just a regular therapist. You also work with your long-standing kind of permanent therapist. So at that point in time, for those 6 sessions, those 6 weeks, you do have 2 appointments, one with your regular therapist and one with
Okay,
your ketamine therapist.
gotcha.
So you're kind of doing double time. And insurance, from my understanding, most insurance will cover those 2 per week. And
Okay.
then when you actually go to get the injection at the clinic, that is $700. It could be
Wow.
$500 at some places. More of an infusion clinic without all the hand holding is more like $300. So it
Okay.
is cost prohibitive.
Sure.
And again, that's why I'm so passionate about legalizing a plant.
Right.
Way more affordable.
Yeah, and we can talk about that more. So you had your initial treatment, and then um have you gone back, or I want to hear more about like the
After.
halo
Yeah. The halo
effect.
effect. Yeah. It was really eye opening for me. So the general idea is that you have a halo effect for about 2 weeks.
Okay.
For the very first time that you do ketamine assisted therapy, I say therapy, psychotherapy,
Okay,
but
gotcha.
we're
Yes.
interchangeably. But anyway, so after the first time, they recommend that you wait 4 weeks, and then you can really see your brain on ketamine versus off, and
Okay.
you'll know that that halo effect has definitely worn off, and you can kind of compare and contrast, you know, how was that for me? And so I noticed that the negative self-talk started coming back
Hmm.
in, and I'm really mean to myself.
Oh gosh.
So that was the biggest aha moment for me. Like, wow, I've been talking to myself this way probably forever. And
Mhm.
then when, I'm dealing with this medication issue, it just really spiraled and got worse. So I'm become
Right.
my own worst enemy. So it was clear to me that the psychedelic therapy was helping me to either those voices are changing or I'm not hearing them. I'm not a clinician, but it was
Yeah,
dramatic difference. So
that's so great. So, and, I have a similar experience. I mean, it is for me, I kind of started thinking I might be depressed, but I really didn't know I was depressed because I've never been depressed. And it was just those voices and the negative thoughts that are like constant, and
yeah,
just um and what a terrible place to be because you can be there often seems to be no light,
you can't
and
escape it.
especially in Minnesota. Okay. So,
Yeah,
but anyway, it's so fascinating to me. Like the more we talk and learn about psychedelics and psilocybin and ketamine, it's just that like general idea that those negative voices are kind of just tuned down, or and then those positive feelings, which for me, I just feel that I'm flooded with like positivity, and I'm feeling more empathetic, and more connection to the people and the universe. And I feel like through us talking, you've described a lot of that same
definitely.
song and dance.
Yeah. Yeah. And it's just wild to think about the whole journey. There's, more and more documentaries happening about how things became illegal in the first place and that whole journey. So, it's just an exciting time. I feel like we're really privileged to be living in this day and age where we're starting to integrate this back into treatments.
And yeah, I forgot, Angie lives in Minneapolis, and so do I, because we're awesome, and so is Minneapolis. Because there's a lot happening right now, along the lines of hoping to legalize plant medicine. I mean, Mayor Fry essentially decriminalized it. Well, he didn't decriminalize it, but it's lowest priority of any offense, in Minneapolis. And then Governor Walz has a task force in place. So it's a group of people, Native American tribal leaders, psychiatrists, doctors, patients that had experienced the treatment resistant depression. So things are happening and it's so exciting. And so you had your ketamine treatment, and then is it kind of like something when you feel the halo effect or these negative voices are kind of re-entering and you kind of need another rejuvenation, you would head back for another.
Yeah. So you could go back to that same clinic. They're aware that it's more expensive and that they're just offering that full service.
Sure.
And that you might not want to continue to pay $700 a pop.
Right.
So they will help you transition to more of the infusion format.
Okay.
So it's I would say really helpful to do the full treatment with the 6 sessions leading in and then the 2 sessions to integrate the therapy. And then for the second and consecutive times, go to an infusion clinic. I
Yeah.
actually was able to find someone that is growing mushrooms and was able to give me the microdosing because, frankly, it's way cheaper.
Well,
And
yeah.
it's something I'm passionate about supporting.
That's great. I mean, I can't imagine. Well, I'm not going to get started on my medical insurance talk, but if I know I need something to feel normal and to feel right and to be a good mom or anything to exist, $700, and you have like corporate insurance, right?
Yeah,
Yeah, and you're still would have to pay that. That's just
right. Still out of pocket.
yeah.
And I mean, personally, I guess I've always been kind of a tree hugger. I would like to use plants wherever possible.
Right.
Just easier on your kidneys and liver and all that good stuff.
Yes.
Personally, and no hate towards ketamine at all. It obviously has helped me so much, and definitely want to support it however I can. And if someone's in a really dark place and they need that triage of relief,
Mhm.
then I recommend it. It's worth every penny of that $700 price tag.
That's very important. I think there's so many people, myself included, when I was feeling low, I didn't know what to do. I mean, I just what there's I probably decided to drink more wine or
Well, right. It's
it's
like whatever you have access to, right?
Mhm.
And so when things become inaccessible or treatment resistant, yeah, a bottle of wine looks awesome. Yeah.
Yeah,
Like you
and
just want to get out of your head because it's a terrible place to be.
I think, we're about the same age, but I just feel like for me growing up, it's just such a natural thing and so ingrained in our culture. Let's, have a glass of wine
Yeah,
or
it's been a long
it's
day. Let's get happy hour.
everywhere you
It's
go.
so
Yeah, exactly.
normalized.
But then little did I know that for me, alcohol was causing me more anxiety and more depression.
Yeah, definitely a
So,
depressant.
no bueno.
Right.
But anyway, I just felt like that was one option, carry on with that. And for me, I happened, to find microdosing or magic mushrooms, psilocybin, was really uh, my saving grace, or, and
Mhm.
it's kind of a similar story because what I'm hearing you say are, the thoughts, the negative thoughts and the depression, and is kind of, pu- I don't want to say like tossed out the window completely, but that for
It
what's
definitely turns down
important
the volume.
is that it's making you feel better and
Mhm.
feeling safe, right?
Mhm.
And that's exactly how it made me feel. And
Yeah.
so much so I can't stop talking about it. So I'm having a podcast. But it's so good to just kind of normalize it because look, I mean, especially after the pandemic, are we still in it? I'm not sure. But
Yeah,
it's,
if you have a suppressed immune system, you would definitely are still in it.
there's so much has happened. What's normal? I don't Nothing is normal, clearly.
Mhm. It really
So
shook us up as a society for
I
sure.
think it's so important to share your story because, like, my whole point is there are people out there, and I was one of them who was depressed, and I was too shy to do anything about it, you
Well, there
know?
is such a stigma and it's really scary. And I'll just give an example. My mom had the same issues in the 80s, and she did not have any, employee rights. There were no, the American Disability Act of 1990 hadn't happened. It wasn't amended for mental disorders like depression and anxiety and PTSD until 1995. So our parents are scared because they could have really lost their job and lost everything.
No
And so
shit. Wow.
today, we have these additional legal rights, we have these protections. And again, people don't know about it. So they're
Right.
terrified. I was terrified, you know.
Sure.
Um, I'm still the same person, I still love to have a good laugh. I love working, I love my job. And I was just going through a really difficult time and was able to take a leave of absence. But starting to look at what if this doesn't get better,
Right.
and am I going to be out on the streets? I'm sure a lot of people are on the streets for this reason.
Sure.
So there needs to be more awareness about our American Disability Act rights. It's more than just visible disabilities.
Yes.
That tends to be the focus, but it covers non-visible too.
Sure. That's so helpful. And I think, to your point, yes, mental health is obviously a major importance to exist in everyday life. And again, just talking about it. And, I'm 44 years old and I have learned more about myself and my depression and my anxiety in the past half year, y- you know,
Yeah.
um, whatever that means. I'm old. But anyway, um, and I just, again, to reiterate, this is medication that and I hope to have an actual doctor who provides, I know a few, these ketamine assisted therapy treatments. And I would love, because I've, just taking it like a brief little look at the brain, they can do those color imagery that shows like a depressed brain. And then a rejuvenated brain.
Yeah, I love that word,
I
rejuvenated. It is a rejuvenating spa-like feeling when you're like, oh my gosh, there I am. I've been like hiding
Did
under
you
all
get
these
to
dark thoughts.
but did it ever go to that level where would they show you your
Like a brain
brain?
scan? But I think that's why the research is so important, because they can kind of validate all those findings, and people
Yes.
love visuals. So
Right.
I think that would be great if you could kind of
Visuals.
compare, like, right? If you could compare, a drunk brain or a depressed brain, and they're almost the same image, to
Uh-huh.
like the lit up, myelinating,
Myelin
plasticating
Yes.
brain
Well,
that's learning and growing on psychedelics.
yeah, and that's literally what I did because when I was feeling so terrible, because I was depressed and drinking heavily and misusing alcohol, it's not too hard to just Google, you're depressed, your brain, and so then I started looking at the,
My
actual
brain.
visual effects of what's probably happening to my brain. But what's so exciting is there's a whole world of color
Yeah.
ahead and expanding and rebuilding. And
Yes.
yeah, it's exciting.
Yeah. I was really looking forward to coming here, and was just, catching up on what's happening in Oregon. And they have done a good job of acknowledging our First Nation people, and how, we've kind of stripped that power away from them. And now we can kind of restore that medicine that they've taught for so many generations, going back so long ago.
Right.
And to really acknowledge that space too. I know that we have to kind of do our Western thing where we validate it with our Western practices and but
Yeah.
it's definitely an ancient healing
No,
method.
yes.
So that
And
would be super cool to learn about too.
I know, and it's so important because it is a sacred medicine. And at the end of the day, I was thinking about that too, because it's like, I've lived here most of my life. I've also lived in Australia, but I know, within the Native American communities here and Aboriginal communities in Australia, alcohol is such a huge pandemic,
Yeah.
epidemic.
Epidemic,
Yes.
I think. Yeah.
Panny, epi.
Problem.
So but here, they were introduced. That's the white people
Right.
drug, and
Mhm.
they're. I feel my body is not meant to have alcohol, and I don't know anything scientifically, and I hope to learn way more when we have experts talk about these things. But it's like, yes, here it is, this plant medicine, basically their medicine that they've been using, and maybe they just need a better discussion about the science behind it and how it can help treat a lot of these issues. But we got to start with those people, our
Right.
people.
Mhm.
And so I get really excited
Start
when
with the history.
yeah, when we talk about it, because to me it just seems so positive, and it seems that's where I like to keep my mind these days, is positivity. So I'm so excited that you were here, and again, thank you so much for sharing everything. And it's such a great story to hear, and
Yeah.
I'm so happy for you.
I'm
too.
happy to be on the other side of it, and sharing some ideas that could help others. And thanks for holding the space.
Well, thank you, Angie.
Listener question. This is from Gabe N in Minneapolis. Let's see. What other things had you tried for depression before this? Like, is it a long battle, whatever, for you?
Yeah. So for me and for my mom, it's mostly hormonal. It's called PMDD, premenstrual dysphoric disorder. So it's not like PMS that's a few days and you're really crabby and just being kind of a bitch. It's more like 2 weeks. So that ends up being like half your life.
Wow.
And so I was able to take Yaz. It's specifically for PMDD. And that it's a birth control hormone treatment. Yes. So that worked really well. But yeah, I also get optical migraines, which is super specific. So if they don't know that you get optical migraines, they can't warn you that, hey, you're going to have a stroke. So that was working for, 8 years. So as soon as I found out I had to go off of it, I ran to my psychiatrist. I was already on Lexapro. So Lexapro is great for both anxiety and depression. I always say it kind of gave me an energy boost. And I feel like a lot of my depression was also coming from sleep deprivation. So my son had insomnia until he was 5 years old.
Oh dear.
So you're talking like colic till they're 5. So 5 years of not sleeping.
Oh my God.
So I mean, it literally causes brain damage, if we're talking about brain damage, because your brain is like kind of soaked in its own waste, and you need sleep to like rinse your brain.
Mhm.
So it was just in this toxic state for 5 years.
So it's just like this.
So I'm like white knuckling it through.
Yeah, but with your depression, it's like this like terrible storm of all like
Yeah.
because and then here you are trying it. So the birth control or Yaz, which essentially you were using it only for your hormones. It's
Right.
not, but it was
And then
controlling.
the Lexapro is for I feel like sleep dep.
Okay. Yeah.
But sleep deprivation will definitely exacerbate depression
Big
and other
time.
things.
Yeah.
I mean, I
Mhm.
feel like if you can't sleep, you're going to gain weight because you're trying to eat to like have some energy somehow.
Mhm.
It's hard to exercise. So that's a whole other tangent. But then when I had to go off the birth control from the stroke risk, there was a drug called lamotrigine, and it's for epilepsy. But it essentially works by quieting some of that electric activity in your brain so that you're not spiraling so hard.
Sure.
But for that to work, you kind of have to titrate up and continually titrate up. And so,
Titrate.
yeah, it's like adding a little bit every time as you like build this resistance to it.
Mhm.
So I was eager to find a gynecologist or someone that understood hormones that could help me find something that wouldn't give me a stroke that would
No
help with
shit.
this PMDD. Because
Okay.
if you're like in that dark place for 2 weeks and then you start to come out of it with the cycle of the hormones, it's still kind of done the damage, right? It's like you
Wow.
might have a little bit of a break for that 2 weeks
Mhm.
off the PMDD issue, but yeah, if it's just continually happening and you can't escape it, that feeling of being trapped can really kind of
Yeah.
make it worse.
So the bottom line is, though, I mean, you've tried
Right.
so many different
Yeah, and I still
things,
take
and
Lexapro, and actually, it from what I've read, it kind of helps with the anxiety piece of any psychedelic experience.
Oh.
So some people will take an SSRI like Lexapro, and then they suddenly cannot have any kind of psychedelic experience, which is unfortunate. Everyone's a little different. My psychiatrist is awesome, so I tell her everything.
yeah.
And she's like, "Well, a reminder that SSRIs do make the brain more neuroplastic as well."
Okay.
So,
Yes.
um,
Can you define? Do you know how SSRI, serotonin?
serotonin reuptake inhibitor. I don't know what
Okay.
the extra S is.
Yeah. Well, I happen to know a lot of people, not a lot, but I know people who carry that kind of not. They say, well, if I take this, an SSRI, which Lexapro is one,
Lexapro is one, yes.
you know, I won't be able to have the benefits of somebody that's not on that drug when it comes to psilocybin or ketamine. But I think, obviously, talking to a doctor or a professional is best.
It really varies.
But I
yeah.
feel that, yeah, it totally varies, and I feel like it's not true. Or so a lot
Yeah.
of people
Well, and
who,
there's a lot of mythology around it only because of that kind of illegal status. And that's
Yes.
unfortunate. But
yeah,
yeah, if you can find a really solid doctor that you trust, I feel really blessed to have a psychiatrist who is a sounding board for me, just so I can feel more safe. But yeah, after I found a new gynecologist, I was able to get on Mirena. So it's working almost as well as Yaz, along with the microdosing and the Lexapro. I am in a good place again. But yeah, it was
Wonderful.
definitely a journey
yeah, a little bit of a
to hell and
trip.
back.
yes, gosh,
Another question, so that we know you're not a doctor, but just in I'm trying to get a sense for it, but how severe, like, would you recommend this for someone who's just got sort of just chronic low grade depression kind of thing like that? Or is this only a kind of extreme type thing as far as you know?
So I have a couple friends that connected me with a psilocybin grower, and they would have more of that low grade depression, and they have a really good success. They've been having really good success with the microdosing. So they do a milligram every 3 days, I think is the correct
I feel
measurement.
with microdosing,
I don't have it
yeah,
memorized.
it totally depends on their protocol, I guess. So
Yeah.
what,
But for the ketamine,
But
For
I'm
the
saying,
ketamine, it is typically for treatment resistance. So they will really run you through, have you done everything you can? So I wasn't drinking. I was already on an SSRI. I had already been doing, hospitalization, inpatient and outpatient. They were like, yes, you need to do this now.
okay.
yeah, talk about, because you say it so well. Like, there's people who feel that they're depressed.
Right. So, I feel depressed as like, I feel sad, I feel happy, I feel angry, I feel depressed. It's like a passing emotion. So I think that's where the confusion can really come in when people don't know what you're talking about. They're like, well, I feel depressed too. It's like, okay, totally valid. But do you have major depressive disorder where it never lightens up? It continues on and on and on, day after week after month after year for some people. And then you can start to have those conversations about treatment resistant depression, because you are trying all of the things and trying to find something that works for
Wow.
you. So I think that's where a lot of confusion can come in. And I brought up the example of, let's say you have diabetes. It's like when you have a sugar crash, that sounds very different from I have diabetes. So,
Right.
it's like you're talking about your pancreas, but with depression, you're stuck with that same word.
Yes.
I feel depressed versus I have major depressive disorder versus I have treatment resistant depression. It's always the same word, depressed. And I think that causes some spin for people. They can't connect the two.
Yes. Well said.
Oh, thank you. So I think I was so used to the dark thoughts, that almost had started to be the most normal feeling for me. So it probably started sneaking in week 3, but by week 4, I was like, okay, it's bad again,
Mm-hmm.
But yeah, definitely 2 weeks of just like, wow, I feel completely better.
And then
that was magic.
Since you've been back and had another treatment, do you find you can make it to the week 3 or 4? Or,
I never even had to go back.
Oh.
Yeah, I was able to find,
Wow.
right. I was able to get hooked into a grower and get that microdose personally.
Okay.
But I would think, just from my own experience, you might do like a macro dose every once in a while and then keep with a microdose. I know that there's going to be a ketamine nasal spray that's intended to be more that microdose effect. So, but I haven't done it.
Quick question. Did your doctor, psychiatrist, were they open? Like, were they like, hey, you should look into microdosing because it has a similar effect? Or how did you know to do that?
Well, she isn't tapped into the whole ketamine therapy. I just, let her know that was the plan, and that I was going to give it a try. And she's like, okay, let me know how it goes. Like, she just had really didn't know much about it.
Oh, okay.
I found out about that through depression outpatient, my outpatient clinic. And so I was kind of updating her, are you worried about Lexapro or these SSRIs and ketamine? The nurse at the ketamine clinic didn't have any concerns, but I'm not taking any chances. And she was like, no, I don't have any concerns, especially if the nurse who's more familiar is good.
Mm-hmm.
I'm good. And, I told her, well, I would like to transition to microdosing psilocybin because this ketamine treatment is expensive. And do you have any concerns with that? And she said, no. But I think she was concerned that I would stop taking Lexapro and start just doing the microdosing, because then I wouldn't really have a medical professional overseeing my treatment.
Yeah.
So for me, and just wanting to be a responsible mom and all that, I am continuing both. But I have heard where people will transition off an SSRI to just microdose. So
I have too.
Yeah. It has happened.
Awesome.
Do you feel like yours is more expensive because you did the therapy? ahead of time? Like, does that roll into that 700?
Yes. So I think that clinic just probably has a lot more overhead costs and offers a lot more services. So they do charge more for the actual medicine. And they acknowledge that. They're like, well, you're probably not going to need all of these front end kind of trust building sessions. So you could just transition to the infusion clinics, and that's where it's closer to 300. So it's not
But
Okay.
why?
forever.
Oh, okay. Yeah. I mean, well, I want to be a huge, you know, what's the word? I would like to support this idea with using the therapy services that are offered between the therapist and the integration afterwards and before. Um, but yeah, it's expensive as all hell. I mean,
Yeah. Well, and to be fair, I probably would have gone to the infusion clinic if I hadn't been able to get access to psilocybin,
sure.
because that would be half,
Oh,
less than
gotcha.
half.
Yeah. How was it that you found? I mean, did you have to go online and Google? Were there many options for you to find a place that offers ketamine assisted psychotherapy?
Well, I had a list of ideas from my outpatient clinic, and Intero was the clinic on the list. And it was the only clinic on their list that had ketamine assisted therapy. So I went with them. But when I found out it was $700, I did shop around and found another similar clinic that was 500. But since it was on a
Yes.
recommendation, I decided Intero would be the way to go, and I don't have any regrets. It was a wonderful experience.
And you're saying Intero.
Intero, Intero, and they did not pay me to say that.
So, can you tell us your experience and how, were you scared from injection on? Like,
Right.
were you sweating? And tell us more.
Well, I guess, after getting so many COVID shots, I'm not scared of needles anymore. But yeah, it wasn't like a big needle or anything. It was just a quick injection in your arm. They ask you which arm you would like. I didn't have any like soreness afterwards like you do with a vaccination even. So pretty low key there. And then once you take it, uh, you're at that half dose, and it's like the beginning of the roller coaster where you're kind of trucking along. You're moving. It might feel like it's happening quickly, but you're not doing these like deep, steep drops or
Loop-de-loop,
loops. Yeah.
upside down.
You haven't gotten to like the big kid roller coaster yet. You're still on the little kid roller coaster. And then they check in with you to make sure you're not nauseous or anything. And so if you're feeling good, then they'll give you the rest of the dose. And for me, I'm wearing these like blackout eyewear. So, and maybe it's because I'm a visual person, I'm a designer and an artist. But I was seeing kind of like patterning, almost like a kaleidoscopic effect, but it's dark. And I was also just feeling the general sense of freedom and that kind of like that endorphin rush that you get when you finally feel relief. And yeah, like that overwhelming sense of love and connection, and yeah, it was such a relief. I can't even begin to describe the sense of relief of, wow, I'm not a completely broken person.
Right.
I can feel happy again, because it had been months.
So good to hear. And so good to hear that it happened almost. I mean, I'm sure you might have been a little bit anxious or because it's your first time. You never know how it's, but the important part is that, you had your a therapist there and a nurse there and you were in a safe setting. And it's just so good to hear that within moments or, that you could
It was
have
pretty
that
quick
relief.
just to get that good feeling again. But yeah, the halo effect was pretty wonderful. So for it to last 2 weeks of just a general sense of well-being
Mhm.
was a dramatic difference for me from before I took the injection.
Wonderful. Well, I am so happy that you found your relief and that you have a healthy and safe option to turn to if there is a next time, if you need to. But again, I just wanted to thank you so much for sharing your story and being so open and, helping the cause to just normalize all of this, and it's okay to
Yeah.
talk about it. And I'm so glad I know your story in case I might know someone who's having a similar
Yeah,
situation. And
exactly. That's a good way to say it.
yeah. So thank you so much, Angie. I really appreciate you and your time.
I appreciate you too.
For more information, please visit mindsonmushrooms.com. Thank you for joining the journey.